Interpretation.
Hola, muy buenas tardes. Hello. Sorry about that. Hi, everyone. Thank you for joining us today. Just remember, if you need interpretation into the Spanish, just go on the bottom of your screen. You're going to see a little icon with like looks like a circle or icon looking like the world. And you could press it and it's going to give you the option to choose the Spanish one. Click on the Spanish one and you'll be able to hear the Spanish interpretation. So, si necesitan interpretación en español para este programa, simplemente abajo de su pantalla van a ver un icono casi similar a un mundo. Lo presionan y cuando presionen ese icono le va a dar las opciones de interpretación en español. Presione la interpretación en español y de esa manera va a poder escuchar la presentación y ver nuestra pantalla a la misma vez. También las instrucciones van a estar en el chat, así que puede buscarlas ahí para dar un poquito más de información de cómo hacerlas. Así que vamos a empezar nuestro taller. We're going to get started. Hi, everyone. Thank you for joining us today. Our session today is health and wellness. Just some things you should know about this session. This session will be recorded. We want to share this knowledge with parents who were unable to attend. All previous sessions can be found in our YouTube link. The link is on the screen and will also be on the chat. We will have our presentation today, followed by a conversation with Ali Sontag. If you do have any questions or any comments, feel free to leave them in the chat. Please remember to mute your microphone, be respectful with your comments, and be brief when sharing. If you would like to be a part of our newsletter, please visit bit.ly/face newsletter. And like always, those links will be found in the chat. Join us for our next session. So these are a little brief preview of the sessions that we have this week. On Wednesday, we have a session with ODLS at 12, and that's with the Mayor's Office for People with Disabilities. On Thursday, and we also have a Go CPS at 4, the application process. On Thursday, we have College and Career at 1, Go CPS at 2, and Ask the Experts at 4. On Friday, we have our Eat Smart, Move More series, and that's Come Inteligente, Muévete Más in English and in Spanish. Sorry. And they will be both at 10. Hi, everyone. Thank you again for joining us. My name is Janet de la Luz. Our session today is Health and Wellness, COVID-19 Protocols. Our presenter for today is Alexandra Sontag, yes, and she's a family and health practitioner at CPS, and she is going to introduce herself a little bit more and also start presenting her presentation. Thank you very much for joining us.
Good morning, everyone. Just switching over to share my screen. All right. Lovely. So just a little bit about me. My name's Ali Sontag. I'm a nurse practitioner, and I focus in family nurse practitioning, which means that I can see anyone from the day that they are born to very, very old. The only thing that I don't do is people while they are in labor having a baby. That has no interest to me. My passion is school-aged medicine. So I really enjoy working with kids, which is why I work here at Chicago Public Schools. Another reason I work at Chicago Public Schools is because I'm a CPS graduate. I went to Chicago Public Schools for my entire K-12 career. I went to Hawthorne and then I graduated from Walter Payton. My mom was a CPS teacher in special ed for 42 years at Wells High School. My high school sweetheart now also teaches at CPS. I have a great aunt who was a superintendent, another cousin who's a teacher. I have a cousin who's a retired lunch lady. My whole family works for CPS, and so This is something that I'm very passionate about. I really believe in public education, and I wanted to create some time to go over some COVID-related health and safety protocols that are happening at CPS right now. So the mission of the Office of Student Health and Wellness is to remove health-related barriers to learning and advanced health equity here in Chicago. Our office does a lot of things, everything from recess and school gardens to surveys about health data to vision and hearing exams, running our school-based health centers. We also do something really unique. If anyone needs help enrolling in Medicaid or receiving SNAP benefits, just give us a call, 773-553-KIDS, and we can actually help you fill out the paperwork and submit it directly to the state. This is a unique program. We're the only school district in the country that I know about that does our own Medicaid and SNAP enrollment. They are great. They are Spanish speaking as well. So if you know someone who needs Medicaid or SNAP, please have them call us, 773-553-KIDS. We also do COVID response, and then nursing lives in our department as well. At CPS, we support the whole child. The whole child is this idea that the only way that we can guarantee, help kids be healthy, safe, engaged, supported, and challenged is to surround them in resources at the school. So this one is going to talk about a little health education, and then health services that are available locally. We also recognize that students are part of the community that they live in. And so we'll also talk about some community resources as well. And the objective of this presentation is to talk about a little bit about COVID and mitigation strategies, and then also to go through some resources available through cps.edu. A little bit about COVID. I'm sure we are sick of this picture, and I will be more than happy when COVID is something that we don't talk about, but as it is still a part of our lives, just wanted to call it out. So COVID is part of a family of viruses called coronaviruses. You can see in this picture, they're called corona because it looks like they have a crown. And in a regular year, coronaviruses make up between 10 and 30% of the common cold. COVID-19 is a new, that's why it was called novel, a new coronavirus that it is not the common cold, right? It's a lot worse. But there's really good news that vaccines are available, and they have really slowed the transmission of this virus, both locally here in Chicago and around the world, and that we know that there are multiple variants. And viruses are constantly changing through mutation, and this is expected, and we're watching it closely. So what is a variant? In my picture here, we can see our forest, and in the middle of this forest, we have where we're going to call our COVID virus. And you can see that while the root, the trunk of the tree is the same, that you get these branches that are just slightly different. So all of it's from the same COVID virus, but it mutates, it changes just a little bit. And those changes are called variation. They're variants. Now, when something changes, it can become weaker or it can become stronger. And when something becomes stronger, makes us sicker, is more easily transmitted, we name those variants. And so when you hear alpha, beta, gamma, and then delta is the common variant right now, it's because it was a little stronger than the original flavor COVID was not as strong as these named variants. So Delta is the most common variant here in Chicago. And there is not, and it's not unexpected to have these variants. There is some good news though. While Delta is more contagious than the original flavor of COVID, the good news is that vaccines are still really highly effective against the Delta variant. And we know that the same things that worked for the original COVID strain, such as layered mitigation, as wearing your mask, staying home when you're sick, these also work against this variant of Delta. How does COVID-19 spread? It's spread through contact with someone's respiratory droplets when they are sneezing, coughing, or talking. I like to put my hand up to my face, and as I'm speaking, I can feel just a little bit of moisture on my hands. Those are respiratory droplets, and that's why masks work. By putting a mask on, I'm capturing those respiratory droplets, and I'm cutting down on the number of respiratory droplets that I'm putting out into the environment. Also, social distancing is another mitigation strategy because respiratory droplets are heavier. They fall to the ground. And so if you're far enough away from someone, you've also cut down on that risk significantly. In most everyday life, we use 6 feet of social distancing as our metric, or physical distancing, which is a little more accurate. But in schools, we use 3 feet of social distancing. And this is because they've done quite a bit of research on how COVID moves in schools. And COVID at 3 feet still is very, very low risk of transmission because schools are a place where children are seated and wearing masks, that we use the 3 feet for social distancing in schools. And we still know that the highest risk of spread is among household contacts, because you sleep in the same house as someone, you spend a lot of time together, you're not wearing a mask when you're inside. And so even now, we still see that household contacts are more likely to transmit COVID to one another. So let's talk about the types of exposure. On the far left side, you'll see our person who is COVID positive. That COVID positive person needs to stay home from 10 days from their first symptom, or in the case that they don't have any symptoms, 10 days from when they tested positive. And that's called isolation. They have to stay home and away from other people to prevent it from spreading. Now, if you were a close contact, so less than 6 feet apart for greater than 15 total minutes, or if between 2 students less than 3 feet apart for greater than 15 total minutes, you're considered a first degree exposure. You were a close contact with a positive person. As a first degree exposure, you need to quarantine. This means you need to stay home and away from others to see if you get sick so that you don't give it to other people. Those first degree exposures are asked to quarantine from 10 days from the time they were last in contact with a positive person. So that 10 days doesn't start when you find out that person was positive. The 10 days starts from the date you were last a close contact of that person. So we do 10 days in CPS. That 10 days, you stay home as long as you are not sick, right? That's a good sign. We do recommend that you get tested. Now, first degree exposures, that quarantine period is only for people who are unvaccinated. Vaccinated people, while can be a close contact, right? They do not have to observe a quarantine. So again, if you're fully vaccinated at the time of your exposure to a positive person, you do not need to observe a quarantine. And this is because we know the vaccines are very effective. They are not perfect. There's no perfect vaccine out there, but the likelihood of you getting COVID is much, much lower. We do recommend that anyone who's a close contact, whether they are vaccinated or not, get tested for COVID-19 around day 5. And this is just because we want to be extra safe and know if someone has it or not. Now, a second degree exposure is someone who was never in close contact with a positive person. They were in close contact with a first degree exposure. A second degree exposure, for example, would be a sibling. So if our positive person child went to a birthday party, right? The first degree exposure was in contact with a positive person. In this case, my sibling 1 has to stay home in quarantine. My sibling 2, who was not in contact with a positive person, does not need to stay home and observe a quarantine unless my first sibling becomes positive. And then now that second degree exposure becomes a first degree exposure. Does that make sense? Put it in the chat and I'm happy to come back to this slide. So who can get sick? Anyone can get sick from COVID-19, but those who are unvaccinated are at a significantly higher risk. And then many people may not have symptoms or have mild symptoms, which is why when there's such, there's COVID in our community, that we do recommend that we wear masks during this substantial and high spread. Symptoms of COVID-19, the most common, like the big three, are fever, cough, and shortness of breath. But we know that's not everything that people have. Many people have fatigue or body aches. Headache is one of the most common symptoms in kids. New loss of taste or smell, sore throat, congestion, runny nose, nausea or vomiting, and diarrhea. So what happens if your child has any of these symptoms? You need to get tested. It's the only way to differentiate some of these symptoms from a common cold. Once that these are chronic symptoms, right, I always have allergies. So I will say, I'll tell you my personal story. My allergies got really bad last week. On Wednesday, I was at work, my eyes started running, I had a sore throat. I went home and I got tested. Even though this is how my allergies act every single year. And I've actually looked back at my medical records. I get tested 2 times in the spring and 2 times in the fall since COVID started, because that's how my allergies work. So when my allergies got worse and I had a sore throat, I went and got tested. It was the only way for me to know that this was not COVID. So it's frustrating, I know, but this is just kind of the best practices to make sure that we're keeping ourselves safe and healthy and our people around us safe and healthy. So it's fall, we're about to have a lot of family events come up, and how do we manage these events safely? If you haven't been vaccinated, please get vaccinated. This is one of the best things we can do to protect ourselves, but also the people around us. If you're not fully vaccinated, wear masks in indoor spaces, especially while transmission is so high. Everyone should wear masks while transmission is so high, regardless of vaccination status. And then try to think creatively about outdoor events. I know my family got together for Halloween. They set up a bonfire. They gave out candy outside yesterday, because they have little ones who are not age eligible to be vaccinated. So just think creatively about how we get together around this time of year. Social interactions are so important. I know that my family missed people a lot in this last year. So things that we're doing is everyone in my family is vaccinated. So we will be getting together for Thanksgiving. If anyone's sick, they will be staying home, right? Or making sure that they've tested negative if they think it's something like allergies. And then thinking of other creative spaces and events to do, such as gathering outdoors if there's a lot of unvaccinated people. Just something for us to reflect on, because I do want us to get back to normal, but we just have to be thoughtful. So let's talk a little bit about vaccines. How does a vaccine work? So in my top left corner, I've got my little pink measles. Measles has these little spikes. You can see each of my pathogens, the things that make us sick, are wearing their own coats, and they all look unique. So measles is pink with these little spikes. Now I have an antibody, because I was vaccinated, that perfectly fits that measles coat. It's a perfect match. You can see it's like lock and key. Now, when there's a new pathogen, when there's something that I haven't seen before, my body doesn't make an antibody to fit onto that little coat. So it doesn't know what it is. And what antibodies do is they stick to the outside of the pathogen and they sound the alarm bells for my whole body to attack. Well, if I don't have any antibodies to sound these alarm bells, my body doesn't know that it's bad. So when I have a new pathogen, I want, ideally, my body to know that it's bad, to sound those alarm bells. And what vaccine does is, instead of making us sick by giving us the whole pathogen, it basically takes off a piece of the coat. You can see my little green guy. There's a little green piece that our body is shown in a vaccine that now my body knows how to make an antibody to fit it perfectly. So that if I ever was exposed to COVID and there was COVID in my body would sound the alarm bells because it would get covered in antibodies and could attack it to prevent me from getting sick. So vaccines work to protect the individual, right? Those little sticky antibodies, they coat the COVID, they sound the alarm bells. My body attacks it and prevents me from getting very sick because it knows that it's bad. But it also protects the people around us who can't get vaccinated. And there's lots of reasons that people can't be vaccinated. Right now, you have to be over 12 to be vaccinated. But there's other people who can't get vaccinated for a variety of reasons. Some people with medical conditions. And by vaccinating myself, I've lowered the risk that I have COVID and can transmit it to others. It's not zero, but it's much, much lower. And I can protect the people around me that way. This is particularly important for those who can't be vaccinated, such as those under the age of 12. It's called cocooning. And cocooning is where we surround our unvaccinated person with as many vaccinated people as we can to decrease their risk of getting COVID. So this is one of the reasons why CPS has a vaccine mandate for our staff. We want our staff to be fully vaccinated so that we can protect our students who are not age eligible to be vaccinated at this time. So we've got 3 different types of vaccines. We have an mRNA-based vaccine, and this is like Pfizer and Moderna. And Pfizer is the one that's available for 12 and up, and soon to be available for 11 or for 5 and up. So mRNA is like an instruction manual, and it tells our body how to make a protein. And this mRNA in this vaccine is the instruction manual just for that little piece of the coat for COVID, not the whole virus, just for that puzzle piece. And it tells our body how to make that puzzle piece to teach our body how to make those antibodies. So Pfizer and Moderna both work this way. There's another type of vaccine called a protein-based vaccine. And this one actually gives those little puzzle pieces, the little tiny green piece. This is not on the market here in the US. You may have family from around the world. It's called Novavax that have gotten this vaccine. Then there's a third type of COVID vaccine called vector vaccines. And vector vaccines are like AstraZeneca and Johnson & Johnson. And both of those vaccines work by using a virus that cannot get you sick and giving that instruction manual inside the virus. So this safe virus delivers the instruction manual to our body. So both Pfizer, Moderna, and Johnson & Johnson all end up giving us the instructions to make the spike protein, that little puzzle piece, but they do it in 2 different ways. What can you expect when you're vaccinated? Pfizer, Moderna, and AstraZeneca are 2 shots in the upper arm, while Johnson & Johnson is a single dose. Pfizer, Moderna, and Johnson & Johnson all have boosters available for kind of a specific group of people. And if there are questions, I can go into more detail on boosters. Generally, it takes 2 weeks after the final shot for your immunity to be strong. We'll consider you fully vaccinated. Even though boosters are available for Pfizer, Moderna, and Johnson & Johnson, people are considered fully vaccinated after the final dose of the original series. So for Pfizer, it's 2 weeks after your second dose, and for Johnson & Johnson, you're fully vaccinated 2 weeks after your first dose. Are the vaccines safe, right? This is the question. And while the vaccines were able to go to the market slightly faster than usual through a process called EUA, Emergency Use Authorization, because it was an emergency, that COVID was very, very, very scary, and we needed to get something on the market quickly. It actually had to meet all of the same safety standards. They don't get to cut corners on safety. So on top of that, Pfizer for 16 and up actually already has full FDA approval. So it went through the EUA, and then Pfizer resubmitted all of the data they normally would, and now has full FDA approval for 16 and up. We know that these vaccines are some of the most studied vaccines in history. The CDC is watching them very closely. There's a program called VSafe, where they are studying, and I participated in that, across the country. These are some of the most well-researched vaccines, and they've been given to hundreds of thousands of people at this time. So how does a vaccine get to market? It starts with preclinical trials, where they're doing the research. Then they go into phase 1, where you have about 100 healthy volunteers to make sure that there's no problems with the vaccine. Then phase 2 is several hundred volunteers to see if it works. And phase 3 is thousands of volunteers to make sure that it is safe and effective. And so even for emergency use authorization, you have to go through all 4 of these steps. It is about the scale of the data. And so Pfizer was able to submit all of their safety data for that full FDA authorization for 16 and up. So let's talk about vaccines for kids. Last week, FDA got together and reviewed the data submitted by Pfizer for 5 to 11-year-olds, and were in agreement that it was safe to give to kids. This is very good news. The next thing that's going to happen is CDC and the AICP are going to get together and make their final recommendations for administration. Once that happens, then we can start giving shots in arms. So 5 to 11 has basically preliminary approval for administration, and now we just need their final recommendations from the CDC. The good news here in Chicago, Dr. Arwady said this last week, there are about 200,000 5 to 11-year-olds in the city of Chicago. We are getting 100,000 doses on the first week this is available. So those are already being shipped from all of the production companies to Chicago. We have 100,000 doses for the first week. So if there are 5 to 11-year-olds who are interested in getting vaccinated, there will be vaccine available. CDPH has allocated out to pediatric clinics, to large pediatric hospitals. All of the Walgreens will be hosting 5 to 11 vaccine. So there will be vaccine available within that first week. There are a lot of hospitals who are getting ready to host vaccine clinics next weekend. I know Lori's will be starting a clinic, and there will be several other hospitals running vaccine clinics. So vaccines are safe and effective for kids. It is a 2-shot series of Pfizer. So it's the first shot, then 3 weeks later, a second shot, and then people are considered fully vaccinated 2 weeks after that second shot. Now, children and adults over the age of 12 receive the same dose of Pfizer as adults do, but children under the age of 11 are approved for 1/3 of an adult dose. And so this is what they presented to FDA. The data for children under the age of 11 is very good at 1/3 of the dose. So it is a smaller dose of the medication. And what they saw was that children had fewer side effects. And they're also just smaller, right? If you're under 11, there are some big kids and some little kids, but everyone's much smaller than a full-size adult when you're under 11. It is an age cutoff and not like a height or a weight cutoff. So if you're under 11, you'll get this 1/3 dose. If you're over 11 or over 12, sorry, if you're 11 or younger, you'll get 1/3 of a dose. If you're 12 and up, you'll get the full adult dose. You don't get COVID from this vaccine, like I said, right? It's that little puzzle piece. And your child can get other vaccines at the same time without waiting 14 days between vaccines. So it's cold and flu season. You can get your flu shot and your COVID vaccine at the same time. These are some normal side effects. So at the site of the shot, a little redness, pain, or swelling is very expected. Those can be managed. Talk to your child's healthcare provider, but using non-aspirin pain relievers like Tylenol. You can also do cold packs to the arm for that kind of local pain. And then sometimes people have an immune response in the rest of their body, such as tiredness, headache, fever, chills, or nausea. Those can be managed like you would for other times that your child has it, but they really should go away within a few days. So the instructions manual only lasts in our body anywhere from 2 hours to 72 hours at the upper limit. So the instruction manual can't keep giving us that little puzzle piece because it actually dissolves, it disappears within 72 hours. So most of these symptoms are very time limited. So, and also some people have no side effects. I will say in my household, I did experience some side effects. I had some chills and some tiredness, and my spouse had none of them. And we're the same age. We don't have any underlying medical conditions that, should change this. But even in my own household, it was 50-50. So some people have no side effects at all. If you're looking for COVID vaccine, you can go to vaccines.gov. You can text your zip code to this number, or you can call this number to find a location near you. I'm going to go through this website at the end, but cps.edu/COVID has all of our vaccination sites here for CPS, and also goes through our vaccination stats for our employees. So here at CPS, we have 4 regional sites. So Chicago Vocational on the south side is open on Tuesdays, Roosevelt High School on Wednesdays, Clark High School on Thursdays, and then Roosevelt High School again on Fridays. So we have our regional sites. There's a link that will drop in the chat if you want to sign up. We also have mobile vaccine events that are coming to a variety of schools that you can sign up your child for. And just as a call out, please remember to schedule your child for their regular appointment for their other vaccines like measles, mumps, and rubella. It's really important that we protect our children, not just from COVID, but from other vaccine preventable illnesses. A little bit about our vaccination plan. We've got our operations, so we're going to do our regional clinics and our mobile sites. You'll also see some marketing and education coming from us and some community engagement as well. Marketing, this is what it's going to look like. You might see these located around Chicago in English and in Spanish. As soon as 5 to 11 are eligible, we'll be pushing out this marketing campaign. So you might see this around. You can call 773-553-KIDS and we can help connect you to vaccine as well. And then how to find what you're looking for. I'm actually going to take us to this website. So cps.edu/COVID will take you to our website. Our website has all of our information on vaccine and vaccination sites, which you can find in our CPS buildings right here. It's a little slow, probably because I have a lot of windows open. You can also register for the COVID testing program for screening testing, if that's something you're interested in here. To do the consent, you just search for your school. I'll search for my elementary school. Oh, I'm going to say that I'm a staff or a parent, and then you can pull up by school. You can also find your school's testing schedule if you've consented for testing. You can look it up here to see when your school is testing. And then there's also community locations, right? So if I'm experiencing symptoms of COVID, I shouldn't go to school, right? I should stay home and get tested. Our testing program is a screening testing program at CPS, so we're testing well people, but there may be times where you need to get COVID tested locally because you're experiencing symptoms. So we have a list of everyone who tests children for COVID, and it's also a pretty fancy map. These are all community sites, so they do, ask for insurance, but they are spread out pretty well throughout the city. There are some areas where there are less, but we wanted to provide that resource. You can also go through the CDC Self Checker if you need to decide whether or not to get tested or to seek medical care. We also report all of our data publicly. So you can see how many cases are reported in CPS. You can click through it by school. And this is the number of tests we've done through our surveillance test or screening testing program inside CPS. So you can see last week we tested over 23,000 people. Oh, let me fix the testing schedule. Yeah, I just noticed that too. It was slow to load. Yeah, I'm going to fix that. I will reach out to them today. They will fix that shortly for me. Thanks for the heads up. Yeah, absolutely. Also some safety best practices. This is where kind of all of our flyers are stored, and as we get new flyers or our guidance changes, they get updated here. So just wanted to take you through that, and then just open it up for any questions.
Thank you, Ali, for that presentation. Does anybody have any questions?
It can be about something I covered. It can be about something I didn't cover that's COVID related. Could be anything about medicine in general. And if you don't have questions, that's no problem. Just want to create some space and time. You can drop it in the chat. Not a problem as well. Yeah, boosters. This is, I will say this was kind of a challenging one for me personally. The data is that the vaccines as they are given are really effective, like more effective than vaccines we've given in the past. So for example, the flu shot is sometimes about 50% effective. And that's like a really good flu shot because there are so many different of those variations, those variants of flu. And so even with, after 6 months, the COVID vaccines are like 70, 80% effective still. It's a really effective vaccine. So when you get a booster, and if you qualify, so if you're over 65, if you have chronic conditions, if you work in a higher risk job, such as something that interacts with people every day, like being a teacher, you qualify for a booster. And a booster basically gives you, in the case of Pfizer and Moderna, a third shot, and it increases your immunity. And I think the most recent Pfizer data is like 96% effective after you get a booster. So it makes this a very effective vaccine. From an equity standpoint globally, there's a lot of vaccine here in the US and there's a lot less vaccine around the world. And so the World Health Organization made the argument that boosters aren't necessary because people are still pretty well protected at 80%. the US has chosen to allow for boosters in those specific circumstances. And so I myself, I'm, in my 30s and relatively healthy, was really kind of reflecting on whether or not I was going to get a booster. I chose to get a booster because they were available to me as a nurse, but also because there are people in my family who are at pretty high risk. And those are the people that I want to see this holiday season. And so that was one of the factors for me that I chose to get a booster. I think if I didn't have high risk family members, I wouldn't have been as interested in getting a booster because it is still very effective, even without the booster dose. Protocol for visitors entering CPS schools. Do parents have to be vaccinated to enter the building? No, we don't require vaccination to enter the building. We do if there is a parent who is a volunteer, called a level 2 volunteer. We do request that they present their vaccination status or participate in weekly testing. But those are for parents who are like volunteering in classrooms every week that are similar, close contacts. They would be working with students, those kinds of things. To go into a building to pick up paperwork, to talk to your student's teacher, you do not need to be vaccinated. We do ask that everyone inside our buildings mask, that they stay home when they are sick, and that they follow social distancing whenever possible. The person who's triplet, if you can just reach out to FACE, we can send someone out to speak. I mean, I'm not booked on parent teacher night at this moment. So absolutely. I've done a couple LSC meetings and those kinds of things. So as people reach out, I'm always happy to support. I think there's a lot of information out there and a lot of misinformation out there as well. So anytime that I or my office of OSHW can support our schools and families, we're more than happy to.
Thank you. So I'm going to translate the question that they left in the chat. If a child takes medication for asthma and allergies, do they have to suspend their doses for that day so they could take the COVID vaccination, or it doesn't matter?
Very good question. So in fact, for the COVID vaccine, you do not have to change anything. So just like with other vaccines, you can take your normal daily medications. They've studied this. You can actually get multiple vaccines on the same day. So you can get your flu and your COVID shot at the same time. It doesn't affect one or the other. The one thing that was very commonly shared early on was to not take Tylenol or ibuprofen. And the reason that we say this, and this is actually true for all vaccines, is that you shouldn't take those pain medications before you get your shot, because we want our bodies to respond to them. And both of them have certain enzymes that calm our body's immune response, and we want that immune response. Now, this doesn't mean that you can't take Tylenol or ibuprofen after. If you have pain, if you have a fever, you can take it like you normally would, but the recommendation is not to take it before you go, because we want to make sure that you are able to have that immune response, because that's the whole point of a vaccine. But yes, your child can take their normal medications just like they would every day on the day that they get their vaccine. I've got a question here about mobile care units, which we've already started. So we have a couple different mobile care units that we've seen that service our schools in Chicago. Our vaccines have already returned. So any of our mobile care units that did vaccinations, they've already come back. Our school physicals have come back. Our dental program is getting started back up again, which is really exciting. There's dentistry in general was a little more complicated in the time of COVID, because you're literally in someone's mouth. You can't wear a mask and get your teeth cleaned at the same time. It doesn't work that way. So that is something that we're looking to restart in accordance with our guidance from the Chicago Department of Public Health. So I know that they're kind of working on that in the background. We really hope that by the end of this school year, many of our services have returned to pre-pandemic, or even better, right? We have more vaccines in our schools now because we're offering COVID vaccines. And so taking lessons that we learned from COVID and expanding them so that we can really support our schools in any way we can. What if you had COVID and were vaccinated with 2 vaccines earlier this year? Should this person get a booster? This is a great question. And in many ways, the people who have had COVID essentially have given themselves a booster. They've been exposed a 3rd time. So a couple things. Boosters aren't required, and take the time to talk with your primary care provider if you're on the fence. I know that I did when making my decision about whether or not I was going to get a booster, and I'm a primary care provider, but I did talk to my doctor about it. So if you've gotten both doses of Pfizer or Moderna, and then had COVID as well, first of all, if you've had COVID, please still get vaccinated. COVID itself, having COVID, gives your body that exposure to the pathogen. But when we study it, we see that the immune response is not as strong as those with the vaccines. That the vaccine teaches your body kind of a more complicated version of COVID and may protect you against future strains, future variants a little better. So if you've had COVID, please still go get vaccinated. You've essentially built yourself in that extra dose, that booster. So is it required? I don't think boosters are required unless you fall into one of those high risk categories. And that if you're fully vaccinated with 2 doses and had COVID, your body's basically been taught about COVID 3 times. So you should have a pretty good immune response. For a little village, are there any stationary vaccination sites in the school? Great, that's a great question. So those regional sites that are set up kind of every week in the same location were selected with the school and the facilities, and also looking at what was available in the community. If you're interested in trying to become one of those sites or think you might be a good host, you can email us at oshw@cps.edu. Oops, put up our email there. Otherwise, we can also host mobile sites, right, that are there just for 1 day, and then they come back 3 weeks later to do the 2nd dose of Pfizer. Something for us to definitely reach out to us about. Those were selected kind of in coordination with a variety of resources, but something that we'll continue to consider, especially as 5 to 11 starts to expand. Also posted on the screen is the 773-553 kids number. This is kind of it's a one-stop shopping in many ways for health. Our hotline staff is amazing. They also speak Spanish. If you have a health-related question, you can reach out to them there Monday through Friday. If they don't know, they will find out. I definitely have gotten some weird questions through them that families have asked, but we're more than happy to try to figure that out for us. I know as a CPS student and family that the district is big, and sometimes it can feel overwhelming to get information and to figure out kind of what's going on. So give us a call and let us do that kind of footwork for you so that we can connect you to the right person. Great question about booster vaccines. Yes, all of the CPS vaccination sites are hosting boosters. You can go to any of our CPS locations to get a booster. A couple things that I'm gonna escape out of here. we are going to go to CDPH's website. This is just their dashboard that kind of tells us all of the data that's happening here locally in Chicago. I'll drop this in the chat as well. This is like one of my favorite sites. You can see our numbers are decreasing. We have a test positivity rate of 1.6. This is great. We're heading the right direction. But for the city, there's also some great resources here, specifically around vaccine. We've got the city's rollout plan, information about boosters. But the thing that I want to call out is our in-home vaccination program. So Chicago is one of the very few large cities that is hosting in-home vaccination that you can qualify for. Right now it's 12 and up. Once they, in like a week or so, they'll expand this down to 5 to 11 as well. You can book your appointment here by calling this number or using any of these links. And anyone who participates in the city's at-home vaccination program is eligible to receive a $100 Visa gift card just for getting vaccinated. You can get your booster doses through this program, but you will not be eligible for the $100. Yep, let me drop that in here. This is a really unique program. They literally make an appointment. I mean, I can click through right now. I live on the north side, and I can make an appointment to get vaccinated. What's my next time? Next week. I can get vaccinated next Monday at home, never have to leave. They'll vaccinate everyone in a household. It's a really great program. And yes, that's right. There's nothing you need to do to get in line for 5 to 11 vaccine. You just make an appointment as soon as they're available. But there's going to be a lot of vaccine available. So I really don't think it's going to be an appointment issue. At least that's what CDPH has told me. And then for the CPS vaccination sites, the mobile sites, we really want this to be for CPS families, CPS employees, so anyone like that can attend. But we definitely recognize that there is also a lot of vaccine out in the larger community as well. CDPH has this vaccine finder where you can actually, all of these places have vaccine. There's a lot of vaccine available. Now this is 12 and up vaccine. You can also call CDPH, their general inquiry line, and they're manned all the time. They do a great job at supporting people. There's a lot of information on CDPH's site that I use this site a lot. They have information about 5 to 11. And 5 to 11-year-olds also are eligible for the $100 incentive if they are vaccinated at a CPS or a CDPH event, except for boosters. Any other questions?
Thank you, Ali, for that additional information. If you have any questions, please feel free to open your mics and you could go ahead and ask them. If there aren't any questions, I think we could go ahead and finish up this presentation. Oh, go ahead, Annette.
Yes, so I have a question. Once your child has been vaccinated, do you share a copy of that vaccination with the school?
That is a great question. Yes, if you could just share a copy of that vaccination or make a copy of the vaccine card. There's a couple things that are important that we have vaccination status on file for your student. One is if they're a close contact of a COVID case, they won't be asked to quarantine if they're fully vaccinated. So it's important that we have that in our records. And then two, if they participate in things like sports, our student athletes kind of in alignment with CDC guidance, we'll be beginning to ask it to be fully vaccinated or to test weekly. So we want to have that fully vaccinated status on file so that
Okay,
they're eligible to play. So
okay,
you can just take a copy to the main office, or they can make a copy for you in the main office, and then they'll put it into their Aspen record.
okay. Now, one other question I have. What if your child has already had, recently had COVID?
Great
Knowing
question.
that she can't get the vaccine right now, you have a 90-day waiting period. Can she get the vaccine 90 days later?
So a couple of things. You're right. There is that 90-day period, and it's really for testing, not for vaccine. So unless your child received something called monoclonal antibodies, they were like pretty sick and in the hospital and they needed to get specific COVID medication, they actually can get vaccinated as soon as their 10 days are up.
Oh, I didn't know that.
There's
Okay,
just a very specific group of people that have to follow that 90-day rule. And it's only if you received monoclonal antibodies for your COVID. Otherwise, you can get vaccinated as soon as your 10-day isolation period is up.
okay.
And
I know that
because
she
this
had
is
to know, okay. Myself and my daughter recently had COVID last month, okay?
Mhm,
I was vaccinated, like I said in the chat earlier this
mhm.
year. So, I was concerned maybe I need to get the booster because I do have some health issues and what have you. I haven't talked to my doctor yet, but my daughter, she had mild symptoms. So did I. I just had like the diarrhea, the fever. She had the runny nose, the cough, and high fever. And so I can't say that the vaccine does work. It does help protect you, where you don't have to go in the hospital. Neither one of us had any breathing problems or anything like that. So
Good news.
I can testify that the vaccine does help you. Yes.
Yep, absolutely. Yeah. So talk to your doctor about whether or not you need a booster, but your child can get vaccinated because that 10-day isolation period is over. It's definitely, and to your point, right? If you do have underlying conditions and you weren't vaccinated, you could have had much worse symptoms. And so I'm very,
Yes.
very glad to hear that it sounds like, while I don't wish COVID on anyone, I'm so
No.
glad to hear that you are doing well and that you didn't
Yes.
have severe symptoms.
Yes, I'm glad too.
Absolutely. Those
Yes.
are good. Those are good things. So,
Yes.
and that's the thing with breakthrough cases. We do tend to see that they are much milder and that people who are vaccinated don't need to be hospitalized.
Right.
This is very different. When we looked at that with my Chicago data, where am I here? The Chicago data, you can see in Chicago just how few people are actually in the hospital for COVID. Right now, it's only 15 people on average in the whole city of Chicago. And that's, to your point, in large part because of vaccination. Because the people who do have COVID, if they're vaccinated, do tend to have much more mild symptoms. And that's really good. Like, this is, if you look at our numbers from last year at this time, I mean, it's really night and day.
Yes, I see. I see. One other question, I'm going to shut my mouth. You said
No
that
worries.
the children can get 1/3 of the vaccine at age 11. My child will be 12 years old this month. So what would you suggest? Wait till after she turns 12, or should she get it now since she's 11, but she won't be 11 for long? So,
Yeah, so the data, there's not a whole lot of data yet on this in-between group. The data that it does say is for those who are under 11 or under 12, that they had really good immune responses at 1/3 of the dose. Honestly, especially because your family is a little more complicated, just call your primary care provider and see if you can talk to one of their nurses,
okay.
because they're going to be the ones who know your kid best, and can make the recommendation. But yeah, you're right at the cusp.
Yeah.
which is very frustrating. I know. Just like,
Yeah.
I don't think either answer is necessarily wrong, right? Because either way, your child's going to get 2 doses, which will give them a strong immune response, especially in your specific case, because their body already knows what COVID looks like,
Mhm.
which, you know, means that it's seen the puzzle piece before, so it's going to be quicker to learn.
Right.
So I don't think there's any wrong answers, but your family's definitely on the more complicated side, my dear. So I would just follow up with
Okay.
your primary care provider.
Okay. Thank you so much.
No worries.
Thank you, Annette, for all those great questions. Does anybody else have any more questions? Feel free to open up your mics. Okay, thank you, Ali, for this wonderful information on the presentation. I think we could go ahead and finish up this workshop. Thank you, everybody, for joining us. Ali, thank you for being here and giving us this information. I hope everybody has a wonderful day. Thank you, thank you, thank you.